to do about sensitivities or allergies to adhesives. So you've had some sort of reaction to your hair system, glue, or tape. You may be wondering, is all hope lost? Do I have to give up wearing a system for good? Well, first you need to rate how serious your reaction was, honestly. If it's something milder, like itchiness and redness, you can proceed to the next step. Try to determine what you were reacting to specifically. Ask yourself, did I do anything differently recently? Anything at all? One common allergen is a chemical found in many glues called methacrylate. Or your allergy could be due to acrylic, which would rule out any acrylic-based adhesive, but a silicone-based adhesive would work just fine. This is an easy fix, as all you have to do is switch adhesive types. If you haven't changed anything about your routine at all, that may not necessarily mean that you're not allergic to one of your tried and true adhesives. In fact, allergies can actually emerge after long periods of exposure. The best way to rule out the problem ingredients is to perform a patch test. Some of you may be familiar with patch tests, but just in case, place a small dot of each adhesive that you're testing on your forearm or behind your ear and write down which is which so that you don't forget. Then leave the adhesive on for at least 24 hours for most accurate results. The other option is that you're sensitive to the piece itself, which would most likely be a latex allergy. In this case, you can use wig bands if it's a full cap wig. That way, the wig doesn't sit directly on your skin around the edges, or you could try another base type. A good rule of thumb is to let your scalp breathe as often as possible and clean and wash it more frequently. This may require switching to daily tape. Opt for hypoallergenic brands such as 1522 or ProFlex. For glues, we recommend something water-based such as Ghost Bond or Safe Grip. If your adhesive or system reaction is affecting your ability to swallow and breathe, please cease use and seek immediate medical attention. Thanks for watching and take care. Bye.